Good morning. Thank you for the opportunity. We are from SGDB3 and we would like to present our student project regarding ergonomic risks in elementary children and its impact on physical development and preventive strategies. Here are the members of our group. My name is Putu Krishna Arsawardini Putri with class digit number 027 and I will present the background of our student project. Elementary school children are frequently exposed to ergonomic risks due to prolonged sitting, improperly sized furniture, heavy backpacks, and increased use of digital devices, all of which can adversely impact their musculoskeletal health and academic performance. Many classrooms use non adjustable desks and chairs that do not accommodate the varying body sizes of growing children, forcing them into positions that compromise posture and causes discomfort, including neck, shoulder, and back pain. Heavy backpacks also pose a critical ergonomic risk, as children often carry loads exceeding the recommended 10 to 15% of their body weight. Furthermore, the increased use of digital devices in classroom has introduced additional ergonomic challenge, as it may lead to poor posture and eye strain. In addition to physical discomfort, poor ergonomic conditions can affect children's cognitive development and academic performance. Research highlights the importance of ergonomic interventions to create a safer learning environment, such as using adjustable desks and chairs, ergonomic backpacks, and posture education. The problem formulation of the student project are: what is the definition of ergonomics? What is the importance of ergonomics on children's development? How is the physical development and body posture in children? What are the ergonomic risk factors in children? What musculoskeletal disorders are related to ergonomics in children? And what are the preventive measures for ergonomic risk in children? The objectives of our student projects are to define ergonomics and its key concept, to explore the importance of ergonomics on children's development, to understand children's physical development and body posture, to identify and analyze the ergonomic risk factors affecting children, to investigate the musculoskeletal disorders associated with ergonomic risk factors in children, and to determine preventive measures for mitigating ergonomic risks in children. Benefits of the student project is divided into theoretical and practical benefits. The theoretical benefits are obtaining new information and providing new understanding regarding ergonomic risks in elementary school children and obtaining references for future research. And the practical benefits are applying ergonomic principles to create safer environments for children and diagnosing and treating musculoskeletal issue early, potentially reducing long-term health problems.
Hello, I'm David Christopher Chandra with the student number 066. I would like to open the second chapter of this presentation, which is the literature review part. I would like to present about the ergonomics in children, which ergonomics is a study that focuses on the adaptation of a job to an individual or the adaptation of the individual to the job. This aims to improve a comfortable, efficient, and safe work environment to ensure individuals' health. The name ergonomics itself comes from the Greek words ergon, meaning work, and nomos, which means law or natural order. Ergonomics plays a crucial role in the development of elementary children, where they spend significant amounts of time sitting, writing, and using digital devices all day long, and unadjusted school properties can lead to awkward posture, leading to back pain, neck strain, and other musculoskeletal disorders. Teaching children about appropriate posture and body mechanics at a young age instills lasting habits that can benefit their well-being as adults in the future. There are three importances of ergonomics in children development. It starts by preventing musculoskeletal problems like back pain, neck strain, and spinal pain. Ergonomics furnitures support the natural alignment of their spine and reducing the strain on muscles and joints. Ergonomics also improves cognitive functioning by creating a comfortable learning environment. It increases students' focus and concentration so they can perform well on their tasks and learning activities. Furthermore, instilling ergonomic principles early on fosters healthy habits that carry into adulthood. Children adopt practices that prevent chronic pain and injuries. It also equips them with a higher quality of life in the future.
So hi everyone, my name is Kadra Cardano with last year's number 009. I would like to explain about the stages of children physical development. So there are several primary stages of children physical development, which are the first one is in infancy stage. The most significant physical development at this stage is the child's increasing weight and height. Here they will also develop basic of their gross motor skills to obtain information about their environment as a form of introductions to the world and life after birth. And in toddler stage, child's gross motor skills keep on developing. This is where children are most physically active in their development. And in early childhood, children's fine and gross motor skills continue to develop. In this stage, children has begun to show better rhythmic coordination abilities. Here, they're also very enthusiastic and confident in learning various types of sports. And in middle childhood, their bones get bigger and harder. The rapid growth of children at this stage has started to slow down. As it slows down, children will tend to be able to be more focused on their cognitive development. And last, in teenagers, the child's physical, cognitive, and emotional growth will develop quickly and very significantly. They will also experience puberty and hormonal changes. And furthermore, they'll also be able to determine their passion, motivations, and aspirations at this stage. So that's all from me. Thank you.
Hello, my name is Kadek Pamandaga Sakarna and my last digit number is 165. Now I will continue the presentation with the characteristic of children's developing structure. So, first of all, with the growth spurt and the posture, for during puberty, rapid skeletal growth can lead to temporarily postural misalignment due to uneven growth rates of bones, muscles, and ligaments, causing issues like slouching and forward head posture. Second, there's impact of sedentary behavior. So, prolonged sitting and poor posture, such as slouching while using device, can worsen postural issues and lead to problems like a hunchback. The third one is the importance of balance and coordination. For developing proper balance and coordination is essential for maintaining good posture and preventing musculoskeletal deformities. And the last one is the environmental factors, which is ergonomically unsuitable furniture in schools can force children into awkward positions, which potentially causing long-term postural issues for the children. That's all from me. Thank you, and my friend will continue the presentation.
Hello everyone, my name is Josephine Eloy. The last digit of ID number is 094. Some non-ergonomic use of school equipment that can impact in children's physical development, such as heavy backpacks, incorrect chair and desk height, improper use of technology, and use of lighting. Number 1. Heavy backpacks. Heavy backpacks can cause bad posture of the children. Heavy backpacks put excessive load on the muscle and the spine. This can cause irreversible change in the spinal curve. Number 2. Incorrect chair and desk height. Children's sitting posture is influenced by the design characteristic of their desks and chair furniture. In addition, choosing the wrong classroom furniture design also affects their achievement. This is because the right furniture will create a comfortable and pleasant learning atmosphere so that student motivation and attention can be maximized. Number 3. Improper use of technology. Small monitor and built-in keyboard can cause improper posture. This causes musculoskeletal pain in children and has an impact on children. Number 4. Inadequate use of lighting. Inadequate lighting environment can cause discomfort and affect both students' performance and visual performance. This can cause eye fatigue and suboptimal visual development in children. Bad posture can also caused by the children's adaptation to reading in a room with a poor lighting. That's all from me. Thank you.
Hello, my name is Nyoman Aimedin Amanda with real digit of study number is 070. Now I will explain about the awkward and static position for a long time. Prolonged sitting in awkward positions is a growing concern for elementary school children. Sitting for long periods in desks and chairs that don't fit their body sizes can cause musculoskeletal discomfort. When muscles are held in a fixed position, they remain under constant tension, which increases the demand for blood flow but can reduce its efficiency, leading to fatigue and stiffness over time. In children whose bodies are still developing, this can result in postural misalignments and even long-term complications like back pain. So that's all from me. Thank you.
Let me introduce myself. My name is Gusala Agung Librawan Dharma Laksana with three last digit of student number R029. I want to explain about ergonomic risk factors of repetitive movements in elementary children. Repetitive movements are movements that are infrequently performed and rarely cause injury. But when the movement is performed in a prolonged period of time, it will cause accumulation of fatigue, strain, and injury. Injuries caused by repetitive movements are overuse injury, such as tendonitis or carpal tunnel syndrome. There are factors that can increase the risk of injury, such as excessive strain, the tools used are not ergonomic for elementary children, and long duration and frequency in doing repetitive activities. That's all for me. The next will be explained by my friend. Thank you.
Hello, my name is Niputurina Ramsudestra with my student number is 130. Now I want to explain about low back pain in children. Low back pain in pediatric population can influenced by various ergonomic factors such as school backpack weight, sitting posture, and prolonged sitting. According to a study by McDonald, 2017, excessive backpack weight is directly associated with an increased incidence of musculoskeletal low back pain in children. Research by Huang et al. Discusses how poor sitting positions and desk heights that do not meet ergonomic standards can exacerbate back pain by forcing children into improper postures for a long periods. And then the quality of life and physical activity levels of children are also related to the onset of back pain. So, integrating regular breaks and physical exercise could help reduce the risk of back pain in children and improve their quality of life. So, in the conclusions, the rising incidence of low back pain in children is closely linked to various ergonomic factors such as backpack weight, sitting posture, and physical activity. Addressing these issues through ergonomic improvements in school environments and promoting healthy practice can significantly reduce the prevalence of back pain among children. That's all from me. Thank you.
Hello, my name is Rani Parawita with last three digits student ID number is 26. So today I will explain about disorder in the neck, shoulders, and wrist. MSDs among children, especially those dealing with ergonomics, could also cause symptoms that involve the shoulder, neck, and wrist. One study conducted during the COVID-19 pandemic demonstrated how 69% of students experience neck musculoskeletal problem. When working on a smartphone, slight neck pain can be developed due to high neck flexion angles that increases. Children also frequently complain of wrist and shoulder soreness, particularly those who are into online schooling. Poor posture or overuse of gadgets, including the use of laptops or tablets, bring about shoulder soreness. Although wrist discomfort is less underlined, it is also a serious problem that with these computer mouses and keyboard accessories can be caused by repeated movements. For ergonomic and using these gadgets for an extended period without proper rest may further aggravate the issues.
Good morning, teachers and friends. My name is Anastasia Andrea Tamerus, and my last three-digit numbers are 154. Here I'm going to explain about the application of ergonomic principles. Children are faced with increased ergonomic risks, which may cause serious musculoskeletal problems. Hence, ergonomic principles are needed to reduce children ergonomic risk that can be implemented in the design of children's furnitures, protocols, and educations given to the children or adults or caregivers. One of the most important interventions are found in schools. Adjusting the tools and educating students about proper posture can greatly reduce the impact of repetitive movements and strain injuries. Disciplines and habits also plays a crucial part to prevent further risk of children ergonomic risks. Guidelines are also needed to support teachers and parents through media coverage and governmental structured programs. Teachers and parents can be educated through posters or trainings to fit children's ergonomic needs. Adults need to be aware of the risk factors of musculoskeletal pain and disorder that can be prevented by applying ergonomic principles. Other than school environment, these principles may also be applied in a home environment. Furnitures and work setup at home may help decrease prevalence of back pain and improve posture. Serious interventions taken may greatly reduce the risk of musculoskeletal problems and injuries. Thank you.
Hello everyone, my name is Priscilla Wijaya. What the last digit name is 236 and I will explain 2.5.2 Ergonomics Interventions in Children. We already know that prolonged use of devices, carrying heavy backpacks, and maintaining sedentary lifestyles can lead to musculoskeletal discomfort and long-term health challenges, especially for children. So, what should we do and what solutions? First one, we can start from their school, improving classroom furniture design to fit their posture and daily activities such as chair, desk, and etc. The second one is encouraging children to actively move and exercise to strengthen their muscle. The third one is aware of postural issues during devices use, such as smartphones, laptop, and etc. And the last one is schools, parents, and healthcare providers need to collaborate in adopting ergonomic solutions for children. Maybe that's all from me, and the next one will be explained by my friend. Thank you.
My name is Ibana Sifa with last digit 121 and I'm going to discuss about the treatment. Chronic pain can also be associated with low quality of life, such as physical, psychological, emotional, and social health problems. Therefore, multidisciplinary intervention involving physical, psychological, and alternative therapies is expected to bring more benefit as an appropriate treatment. These are some treatment approaches that can be considered. One, medication intervention. NSAIDs such as aspirin, celecoxib, phenoprofen, ibuprofen, indomethacin, ketoprofen, meloxicam, naproxen, and rofecoxib are widely prescribed to manage chronic pain, including musculoskeletal pain. However, the effectiveness of NSAID use is still under research. Not only that, the susceptibility of polypharmacy is also a consideration in prescribing NSAIDs in chronic pain patients. Second, cognitive behavioral therapy. Pain, stiffness, and fatigue are closely related to human thought, feelings, and behavior. CBT offers psychoeducation that is expected to help patients regulate negative thought, moods, and emotion. CBT is also expected to help patients find appropriate coping mechanism, which can help patients to relax and relieve the pain. 3. Occupational therapy. Occupational therapy is highly recommended multidisciplinary approach to preventing musculoskeletal discomfort. The goal of occupational therapy is to help patients with their involvement in the activities of daily living, instrumental activities of daily living, play, and rest. It is hoped that through this therapy, patients can improve their physical, mental health, and social participation, such as improving academic achievement and also roles in society. Because this therapy is done by multidisciplinary, the approach has several scopes such as skill-based training, motoric training, therapeutic approach, peer support, and many more.
Thank you for the opportunity. My name is Lurutanam Sidi with last three digit of my student number is 135. And now I will explain about the last chapter of this student project, conclusion and recommendation. Next. Okay, for the first subchapter is conclusion. We have six conclusions of the student project based on our problem formulations. The first conclusions is ergonomics is the science of designing workplaces, tools, and tasks to align with human physical and cognitive abilities, aiming to enhance comfort, safety, and efficiency while reducing the risk of injury. The second one is ergonomics is crucial for children development as it promotes proper postures, prevents musculoskeletal issues, and enhances focus and academic performance. Early adoption of ergonomics practice helps prevent long-term health problems, contributing to better overall well-being into adulthood. And the third conclusion is children's physical development involving motor skills and postures, with puberty causing temporary misalignment due to rapid growth. Regular physical activity and ergonomic supports are essential for maintaining good postures and preventing long-term musculoskeletal issues. Next slide. Fourth, ergonomic risk factors for children include heavy backpacks, incorrect chair and desk heights, improper use of technology, inadequate lighting, prolonged awkward postures, and repetitive movements, which can lead to musculoskeletal issues, postural misalignment, and overall discomfort, impacting physical development and long-term health. The fifth one, musculoskeletal disorder in children related to ergonomics include low back pain from heavy backpacks and poor sitting postures, as well as neck, shoulders, and wrist pain from prolonged of electronic gadgets. The sixth one, those conclusions, preventive measures for ergonomic risk in children involve applying ergonomics principles to school furniture and home setups, educating students and caregivers about proper postures, and promoting regular physical activity and breaks to reduce strain and discomfort. That's for the conclusions. Next slide is for recommendation. Okay, for the second subchapter, we have recommendations, and we have three recommendations for the student projects. The first recommendation is research can be conducted to find out whether or not ergonomics in an elementary student in school in Indonesia or Bali is well implemented. The second one, responsible parties like government should improve the design of school and home furniture to ensure ergonomics adjustment that support proper postures, reduce muscle strain, and enhance comfort during learning. And the last recommendations, children and parents should be educated about ergonomic principles and safe technology use and monitor backpack weight to prevent back injuries and encourage regular physical activity and ensure proper rest during technology use, promoting correct postures to minimize the risk of musculoskeletal problems. Next, okay, and that was the last slide of our presentations. We are apologies if there was some mistakes of this presentation. Thank you for your attention.